Today I want to talk about something that many parents of young children worry about. What if my child chokes on something? It's a scary thought, and unfortunately, it can happen in the blink of an eye. Small children are naturally curious and they often put things in their mouth to explore. This behavior makes them more likely to accidentally choke or block their airway. In emergency like these, every second counts. It's important to know how to recognize the signs and act quickly to save a child's life. This case will show us the key steps to take during such emergency and what we can learn from it. Let's check it out. Assalamu alaikum. Today I'm going to read a clinical case number 11, that is a 2-year-old with severe stridor. This case involves a 2-year-old boy presenting with severe stridor and respiratory distress, which is a red flag for upper airway obstruction. The key clinical features are hypoxia, agitation, marked tracheal tug, poor air entry bilaterally, and no wheeze, along with no significant past medical history. The immediate problem was a compromised airway due to obstruction, which is life threatening and requiring urgent intervention. So, here the first question asks, what would be the first 3 steps in management? Select 3 answers only. Child's treatment focused on stabilizing the airway and restoring oxygen levels as quickly as possible. So, first, according to the guideline, the first step in management is call for senior help. An anesthetist and ENT surgeon were contacted immediately. Severe airway obstruction, including performing intubation or a surgical tracheostomy if necessary. Next, administer high flow oxygen. The child was given oxygen via non-rebreather mask to ensure maximum oxygen delivery while minimizing agitation. Third, nebulized adrenaline. Nebulized adrenaline was administered to reduce airway swelling. This helped improve systems temporarily and bought time for further evaluation. So, invasive procedures like IV canalization or imaging were deliberately avoided because these could agitate the child, further leading to complete airway blockage. The team prioritized keeping the child calm and stabilizing the airway first. So, all options are wrong. Second question, what is the most likely cause of this child's respiratory distress? Select one answer only. A child present with stridor, several conditions can cause upper airway obstruction. In this case, the most likely cause was a foreign body due to a sudden onset of symptoms. Other possibilities were considered but ruled out. Let's go through them one by one. Bacterial tracheitis. This condition usually accompanied by high fever, toxic appearance, and thick secretions in the airway, which were absent in this child. Next is epiglottitis. In epiglottitis, children often appear very sick and toxic. They may have high fever, drooling, dysphagia, and assume the tripod posture, means leaning forward to breathe. This child had none of these signs, so epiglottitis were ruled out. Next option is retropharyngeal abscess. It present with neck stiffness, sore throat, fever, and muffled voice, which were not observed in this child. Next is viral croup. Croup typically present with a barking cough, low-grade fever, and symptoms of viral upper respiratory tract infection. This child had no preceding illness, cough, or fever, making croup unlikely. This case emphasizes the importance of acting quickly and systemically in pediatric emergencies. According to guidelines, recognizing signs like stridor, hypoxia, and respiratory distress is vital to prevent life-threatening complications. If you have any question regarding this case, comment below, like, subscribe, and share.